Hello, I'm Lucy Robin and I'm a consultant doctor looking after children with diabetes. About 1 in 800 children has diabetes, which is a condition they will have all their lives. A very quick summary is that it causes problems controlling the level of sugar in the blood. Too high and people can feel or behave differently or be unwell. The same if the level goes too low. The sugar levels in everyone are controlled by insulin, but in diabetic children, this insulin isn't made in the normal way, so insulin must be given as regular injections or by a pump. Most children with diabetes have the kind called type 1. We don't fully understand why type 1 diabetes occurs, but we do know it has something to do with the body's immune system going a bit wrong. It's not anybody's fault and not caused by a sugary or unhealthy diet or by being overweight. When a young person is diagnosed with diabetes, it impacts on many aspects of their everyday life. The first aim of looking after diabetes well is that kids can learn, achieve and do all the same activities as anyone. We know that schools play a really important part in the daily management of a young person's diabetes. This might be quite intense in primary school, but secondary school pupils also need some support now and then. You may have met children or adults with diabetes before, or this may be the first time anyone with diabetes has been in this school. Either way, this DVD should help you understand a little more about this condition. This DVD has been developed partly by people who treat young people with diabetes, but mainly by people who have it. Because of this, I hope it gives some insight into what it really means to live with diabetes. After watching this, we hope you will understand a few things better. You'll be hearing about what is involved in managing diabetes for a child in school, what role teachers and teaching assistants may be playing in helping a child with diabetes, how to look out for both low and high blood sugars and what to do about them, the types of things which affect blood sugars like sport, illness and stressful situations, the effect of diet on diabetes. Of course, our diabetes team will still be doing further teaching. We're also always at the end of a phone if there are more questions. I'm now going to hand you over to some of the experts who truly understand the issues they face on a day-to-day basis, managing their diabetes in school.
Hi, I'm George and I'm 13. I was diagnosed with diabetes just before Christmas 2012. With a little help from my friends, I'm going to explain about diabetes and how we manage it in school. Dr. Robin has already explained what diabetes is, but if it's okay, I'm going to explain it in my own words.
Our bodies are very clever. They take the food we eat and turn it into energy. We need energy to run, swim, sleep and grow. When we eat food, the glucose goes from our stomachs and into our blood. But the glucose is not good to us in our blood. It needs to get into our muscles, fat and liver, where it can be stored until we need energy. The hormone insulin is produced by cells in the pancreas called beta cells. They know how much glucose is in our blood. After we've eaten food, they find that there is too much glucose in the blood. So the beta cells send a messenger to tell the stores in the muscles, fat and liver to open up. The stores open up and let the glucose in. Now the amount of glucose left in the blood is just right. And the same thing happens every time we eat a meal or snack. Our bodies just turn some of the glucose in our stores into energy when we need it. So what happens when we get diabetes? For some reason the beta cells are wiped out. This is caused by the body's own immune system which attacks these cells. And when this happens, the glucose stays in the blood and cannot enter the cells to give us energy. No one knows why this occurs, but it can be a combination of things such as environmental, genetic, or a virus. What we do know is it's not contagious and is not caused by eating too many sweets or having a poor diet. Signs and symptoms of diabetes are increased thirst, using the toilet more frequently, weight loss, and tiredness caused by lack of energy.
Diabetes affects different people in different ways, but the way that it's managed is all the same. Each young person with diabetes will have an individualised care plan for the management of their diabetes in school. You now know that diabetes is caused by the lack of beta cells in the pancreas. Because they're no longer counting the level of glucose in the blood, we use a blood testing meter instead. We test our blood before we eat and any time we may feel unwell. Some young people also test their blood before sport or physical activity.
The most important aspect of blood testing is washing our hands before the test. If we forget to wash our hands and have been touching something sweet, this will give a false reading and potentially result in an incorrect amount of insulin being given. Hands need to be washed with soap and water and dried thoroughly. To test our blood, we insert a strip in our meter, prick our finger using the finger pricker, and then place a drop of blood on the end of the strip. The meter will then tell us our blood glucose level. A normal blood sugar will be between 4 and 7 millimoles.
And because our pancreas is no longer producing insulin, we have to give ourselves insulin either by injection or insulin pump.
Some young people deliver their insulin through an injection. Younger children may need assistance with this process. Don't worry, as a diabetes team will help you with training and support. The most important aspect of this process is to be needle safe. Once the needle is placed on the end of the insulin pen, the outside cap should be removed, alongside the thinner needle sheath, which should be discarded. The cap should then be replaced to keep the needle sterile, but also to protect all involved from a needle stick injury. An air shock should be carried out to ensure the needle is primed and then the correct amount of insulin dialed up on the pen. The injection can then be given. Once the injection is completed, the outside cap must be replaced. The needle is then removed from the pen and discarded in a Sharps box. Sharps boxes are provided by parents and should be returned to parents when full. Another way of delivering insulin is by an insulin pump. This is a device that is attached either directly to the skin or by a small tube which leads to a cannula, most commonly sited on the tummy or legs. If you have a young person in school with an insulin pump, once again, don't worry, as a diabetes team will provide additional teaching and support on insulin pump management.
So how do we know how much insulin to give? Some young people give a set dose of insulin at meal times which has been prescribed by their diabetes specialist nurse or doctor. Alternatively, we can count the carbohydrates in our food and work out how much insulin is required for the particular meal we are eating. Some blood testing meters help us work out the amount of insulin required for our meals, as long as we know the carbohydrate content. I'm now going to hand over to our dietitian Alison, who will explain more about diet and diabetes. Alison!
When young people are diagnosed with diabetes, they are given general healthy eating advice appropriate for their age. The same recommendations will apply to their classmates, so children with diabetes should not need to be treated differently. At school, some young people will be counting carbohydrates at lunchtime. This enables them to work out how much insulin to give with their meal. Those who are carbohydrate counting will need to know what they are eating before they test their blood sugar and give their insulin. Insulin should always be taken before eating. If for some reason they cannot eat what they have counted for, they will have to make up the carbohydrates with suitable alternatives such as milk, fresh juice, bread, etc. 200 ml of fresh juice or a large thick slice of bread contains roughly 20 grams of carbohydrates. To help count carbohydrates, there is a book called Carbs and Cows, which is available from Amazon or the Carbs and Cows website. If further help is needed, I can visit a student in secondary school to help them count their meals, or I can carbohydrate count meals for children attending primary schools. Some young people will be giving a set dose of insulin at lunchtime. It is important that they test their blood sugar before lunch and give their insulin no more than 10 to 15 minutes before they eat, as waiting longer before eating could lead to a hypo. If their blood sugar is high, they may need to give extra insulin. Information about this will be in the young person's care plan. It is important that they include a starchy food with their lunch, for example bread, potatoes, pasta, rice, etc., and that a good portion of this is eaten. If someone is too full to do this, they may need a drink of milk or fresh juice to ensure that they do not go low in the afternoon. Once insulin has been given, young people should not have to wait in a queue for lunch as they may go hypo whilst waiting. It is therefore recommended that a pass is given to allow the young person and a friend to go to the front of the dinner queue. Healthy eating principles should apply at lunchtime, and I would advise young people to choose fruit or yoghurt as a dessert most days rather than a sponge pudding or cake, which should be limited to once or twice a week. Unless a young person with diabetes needs to treat a hypo or is doing PE at school, snacks between meals should not be necessary. However, if children are in a class where snacks are available mid-morning or mid-afternoon, for example milk and fruit in Key Stage 1, they should be allowed to have a snack with everyone else in the class. Ideally, their blood sugar should be tested prior to the snack, and if it is above 17 millimoles, a diabetes nurse should be contacted to check whether or not a snack is still appropriate. If sweets or buns are being handed out by classmates on their birthday, please try to ensure that they are given at the end of the day and ask everyone to take them home and let parents decide when they can be eaten. If need be, they can be eaten as part of a meal after the appropriate amount of insulin has been injected.
So, how do we manage our diabetes in school?
In school, I manage my diabetes by testing my blood when I need to and eating when I need to.
I manage it in school by testing when I don't feel really well and just keeping all my supplies on me.
I do it with my buddy and my teacher. I have a teacher at school that looks after me, and I go into a little room at dinner time to do my injections.
Each young person will have an emergency box in school. It is the parents and young person's responsibility to ensure all supplies are available and in date. It is advisable that the boxes are reviewed at the end of each half term to ensure they're always adequately stocked.
This box should contain a spare blood testing monitor, a spare box of strips, lancet drum, spare insulin pen and needles, glucose tablets or some form of fast-acting sugar, glucogel, carbohydrate snacks, for example digestive biscuits, spare insulin vial or cartridge, pump supplies if on insulin therapy, and spare batteries.
So I suppose now I'd better share with you the important aspects of diabetes management. One of the most common issues that may occur is mild hypoglycemia. A hypoglycemic episode, or hypo, is blood glucose less than 4 millimoles, but at times you may feel hypo at a higher level than this. If a young person is saying they feel low, please listen to them, as if they have hypo symptoms, this must be treated as a hypo. If a young person becomes hypoglycemic in school, you should never leave them unattended, as they could wander off on their own and not know who or where they are. To treat a mild hypo, it is important to use fast-acting sugar. The most commonly used treatment is dextrose or Lucozade tablets, but suitable alternatives are
Full sugar cola, Lucozade drink, normal Lucozade, not Lucozade Sport, sugar, jelly beans or jelly babies for young ones who won't eat the dextrose, or honey and jam.
The amount to give depends on the age of the young person. You'll find this information in the young person's care plan, or if unsure, please contact a diabetes nurse for advice. Fast-acting sugar will normally take between 10 to 15 minutes to get into the bloodstream. Blood glucose should then be tested again, ensuring the hands are clean. If the hypo is not resolved at this time, with the blood sugar still being under 4 millimoles, or the young person is still feeling hypo, dextrose should be repeated and a further test carried out in another 10 minutes. When the hypo is resolved, the young person needs to have a light snack to maintain blood glucose levels above normal, or if it is lunchtime, they can go straight on to have their lunch. The most common signs of symptoms of hypoglycemia are
Tiredness, having blurred vision, sweating, hunger, being grumpy, feeling nauseous, looking pale, not being able to think properly.
Excuse me, can you tell me where the diabetic clinic is?
I don't really know.
Right, thanks.
Being anxious, shaking, feeling angry.
But it's important to remember that all young people are different and will feel their hypos in different ways.
I shake like a leaf blowing in the wind, and it's not really, it feels really bad, like everybody's against you. You feel weird. The symptoms I have are headache, I go really pale, and it's really, so if people who know me know when I feel hypo, like my mates or my family, because they know my normal skin colour and they know when I go pale.
So, how do we manage a mild hypo during the school day?
Please, miss, I need to test my blood. I feel low. It's only 20 minutes till lunchtime, and get on with your work and you can do it then. Please, miss, I need to test my blood. I feel low. Go to the medical room and see the nurse. Can my buddy come with me? No, they have work to do. Go on your own. Please, miss, I need to test my blood. I feel low. Okay then, do your test now and have your Dextro if you need to. Do you have a snack in your bag, or do you want me to get one from your emergency box?
Sometimes a hypo can be a bit deeper and the young person may need help to test their blood and raise their blood sugar. A moderate hypoglycemic episode is when a young person cannot eat or drink because of the severity of the hypo. If this happens, a person trained in the management of hypoglycemia will need to use the tube of dextrose gel from their emergency box. Squirt some gel onto your finger and then rub this on the inside of the cheek area between the teeth, cheek and around the gums. Repeat this until about half of the tube is being used. Do not put the gel in the centre of the mouth as this could lead to choking or the young person may bite you. Young people in moderate hypoglycemia are not aware of what's going on around them or what they are doing, and most will not remember anything about the hypo after the event. When this has been done, retest the blood sugars in 10 to 15 minutes. If the blood glucose is still under 4 millimoles, repeat the process with the second half of the tube. As soon as the young person becomes aware of what is happening, revert to the treatment for mild hypoglycemia. If support and guidance is required at any stage of this process, please call the diabetes team. In rare circumstances, a hypo can develop deeper. This is called severe hypoglycemia and could result in the young person fitting or even collapsing. Severe hypoglycemia could be the result of a mild or moderate hypo not being treated correctly, too much insulin being given at the last meal or the wrong amount being given, not enough carbohydrate being eaten before or after sport, or illness. Management of a severe hypo is more serious. Let's go back to the experts and let them show you how to manage this. Georgie! Ebony! Rosie! Where are you now?
Georgia? Georgia, are you alright? Georgia, wake up. I'll go and get a teacher. Miss! Georgia's fainted. Miss, Georgia's fainted in the corridor. Has she? Show me where she is. Georgia, it's okay. I'm going to put you in the recovery position. Help's on its way. Hello, this is Mrs. Goodwin from Brighouse High School. One of our pupils who is diabetic has collapsed and we need an ambulance quick.
So, just to recap on the 4 important points. 1. Call 999 immediately, informing that you have a diabetic child who's been found collapsed. 2. Do not move the young person except to put them in the recovery position. 3. Test the young person's blood glucose to ensure that the collapse is just due to diabetes, not to fall or other injury. And 4. Do not put anything in their mouth as they may choke. Now then, I think that just about covers low blood sugars, but how do we manage our high blood sugars? A high blood sugar is a blood sugar 30 millimoles and above. This is called hyperglycemia. High blood sugars occur because no or not enough insulin has been given at the previous meal. The young person may have had a snack without insulin. They may be unwell, going through a growth spurt or hormonal changes, or been put under stress. They may be less active than normal, or the insulin may have been exposed to extreme weather conditions. If blood sugars are high, please give the young person a glass of water and call the diabetes specialist nurse immediately for further advice. It is important to note that some young people don't feel any different